Unfortunately, there's so much now. We actually had to break this into two parts. There's simply too much to cover in 2 hours, not possible or practical to do it all at once. And to be very frank, it's probably going to change by the time I get to the next part. It is changing every day, hour by hour. What we go over with you today may not be fully updated by tomorrow, so please keep that in mind. This is totally fluid. The feds are pumping out guidance. The state is pumping out guidance. The state has put out guidance and is changing them. Look no farther than what is an essential business. The construction industry exemption has changed 4 times in that regard. Some of the guidance that we're going to go over here is updated, believe it or not. The COVID-19 sick leave has in fact been updated, their guidance. The employment law situations are being driven by what is occurring. There are questions, very detailed questions that we have to ask when we're confronting with employment situations. We simply have to adapt the OSHA rules, the ADA rules, the new statutes specifically to the situations that are in fact occurring. But it's the wild, wild west. Let's be frank, and there's a lot more to come in that regard. I put up here all my contact info. I think most of you who are on this probably have this already. I would urge all of you to follow me on Twitter and LinkedIn. I really get no out of it other than it's a nice, simple way for me about information to you. And if someone could mute themselves, I think someone is unmuted because we're hearing it. It'd be great. The LinkedIn and Twitter is this nice, simple way. I'm probably putting out 10 to 12 posts a day on legal updates that are in fact occurring, and quite frankly, there's a lot of them, and I don't think you can keep up to date with them all. Okay, so what are we going to talk about today? Very general background, coronavirus, and some preliminary guidance. Most of you probably know all that already. We won't spend much time on that. One of the things I will spend a few minutes on is talking to you that I believe you should put in place a COVID-19 employment policy. You're going to see that the biggest component of that are travel restrictions on your employee. You can control travel restrictions from a business perspective. You cannot directly control personal travel, but there's a method by which we can indirectly control it, basically notice to you. So let's assume you're an essential business, you're still open. Your employee, for whatever reason, gets their kicks and says, I'm going to go to New York City this weekend. Nothing you can do to prevent the travel, but you could request notice from the employee, and then the employee would be quarantined under your policy for 14 days before he or she is allowed to come back to work. You are going to be allowed to do that. So putting in place a written policy is going to be very helpful in that regard. You'll also see having in place a written policy will help you set up a defense under the New York State COVID-19 emergency sick leave statute. There is, when you get to the slide, I've referred to it as your stupid employee defense. A policy will go a long way to help you establish that defense. We're going to talk about OSHA issues. OSHA has issued some wonderful guidance. Some of it's very practical. Some of it is wishful thinking. You're free to take whatever you wish in that regard and use it. Someone has asked me, is this being recorded? Can I view and share it later? It is being recorded. I'm assuming it would be shared later. I know it is being recorded. Okay, then we'll talk about some Fair Labor Standards Act issues, please. And I have a message from the chamber. It will be shared. So remember, the decision to send someone home is not the same decision as whether you have to pay them. Those are two separate and distinct decisions. The payment decision is driven by the Fair Labor Standards Act and the New York State labor law. The U.S. Department of Labor has put out some guidance in that area. We'll quickly go over that. I think most of that is common sense, but there will be a couple situations that I want you to keep in mind. You know, one of the things also that many employers are doing are converting their salaried exempt employees to hourly rate employees during the pendency of this emergency to keep them working on a part-time basis. That is allowed. You simply have to use the new Wage Theft Prevention Act notice. Can I cut hours? Sure. There's no problem with that. Can I change job duties? Sure. A few exceptions will be: are they a member of a union? And do they have an employment contract where they are dictated to what their specific job is? We'll then talk about New York State's emergency COVID-19 paid sick leave law. We have seen multiple guidances issued by the state of New York. You might look at some of the links I give you later today, and there will be nothing there. And then you can go back 2 hours later, and suddenly it's there, maybe in a new form, maybe in the same form. That is what is going on. The state is constantly revising some of the materials that I'm giving you. You will see these links, and you know, I can't promise you they're going to be good links an hour from now, let alone a day from now or 2 days from now. Okay, so then we will continue. We'll talk about some union and employment contract issues, which I've alluded to. Workers' compensation and unemployment issues. We're going to spend a lot of time in the second session on unemployment and the Families First Coronavirus Response Act. I will generally mention it here. The workers' compensation, you're in border locations. So if one of your employees comes to work every day in New York, but now you're sending them home and they are working temporarily in Pennsylvania, the question is begged: do you have workers' compensation coverage to cover their actions in Pennsylvania? Most policies are written and says, sure, on a temporary basis. The question will be begged: what is temporary? How long will this last? And the second question that will be begged is, does Pennsylvania law require you, regardless of how long the employee is going to be there, to have independent coverage under Pennsylvania law? We'll talk a little bit about the best practice. We will then go into the EEOC COVID-19 guidance. Believe it or not, we had another pandemic back in 2009. Most people don't remember it. During that time, the EEOC unveiled pandemic guidance. We did training on it years ago. Everyone seems to have forgotten that H1N1 was in fact a pandemic. We'll go through that, you know, some of the critical questions the EEOC answered for us late last week. Can I take an employee's temperature? Yes, you can. Can I make employment decisions based on individuals being diagnosed with COVID-19? Yes, you can. And we will go through the various scenarios for you. Lastly, and we definitely won't get to it today, the Families First Coronavirus Response Act, and I may even have updated slides for you by then, because the feds just keep rolling out a guidance in that regard. I think we're all at home working for the most part. Hopefully my internet does not go out and my power does not go out. And if it does, well, we'll figure it out and how to adjust accordingly. My power did go out the other day, so I find that humorous to say the least. Okay, so let's start with coronavirus in the workplace. You're probably on information overload about coronavirus, what it is, and its background, when it began, etc. One of the things that OSHA encourages is general practice for employers: washing hands, hand sanitizer. We believe we know how it is spread, et cetera, but I think the information on that is ever changing. And you are allowed to encourage your employees to use these best practices. Getting through that, let's talk a little bit about employer obligations, both most likely under OSHA and then really common sense right now. Some of the things that you as employers should do, especially if you're still open either fully or in a limited capacity, is an assessment of hazards to which workers may be exposed in your workplace to COVID-19. Obviously that is going to differ depending on the workplace. If you're a healthcare provider, a dentist, that will differ greatly than if you're an accounting office with a small accounting staff and your clients don't come in. OSHA wants you to evaluate the risk of exposure. And by the way, in a few minutes, I'll give you a link to an OSHA publication that explains to you step by step how to do these things in more detail. Some of the guidance is practical. Put out hand sanitizer, put out shields. So like we're seeing now at the supermarkets, plexiglass shields in front of the cashiers so that you can't breathe on them. Some of the other things that OSHA mentions is put in a new ventilation system. Well, yeah, okay, sure, we'll get right on that in the middle of a pandemic. So some is practical that OSHA puts out, and some is wishful thinking or long-term planning that you may want to, in fact, think about. You want to select, implement, and ensure workers use controls, both administrative and otherwise, such as physical barrier, social distancing, and appropriate hygiene. Remember, if you're open and employees are not doing appropriate hygiene, don't forget your discipline. I'm not going to wash my hand. I'm not going to do this. Yes, they are. You can discipline them up to and including termination. Just document it for me in that regard. And given some of the unemployment amounts that we're seeing individuals going to get, some are going to try to go on unemployment. Remember to oppose the unemployment if you believe it is appropriate. Best source of information on COVID-19 is most likely the Center for Disease Control and Prevention. I've given you the link here. You're actually obligated under law to stay abreast of the developments, especially under OSHA, and use the best information. You'll also see that conveyed to you by the EEOC, so that is why I'm giving you these web pages. You need to stay up to date on the Center for Disease Control travel restrictions. I've given you the link to the travel restrictions. We are now starting to see, under the COVID-19 sick leave law, guidance be issued. Everyone is used to, it's got to be a level 2 or 3 country. New York State is now a level 2, 3, and in some cases a level 4 country. We just saw the first guidance, which I'll talk about in a little bit, rolled out in that regard. So again, ever changing. What is a level 2 or 3 country is ever changing in that regard as well. OSHA has set up its own COVID-19 webpage. I've given you the link to that here. Great information on there, but again, I think be selective in what you read. You don't have time to read it all, or maybe you do at the end of the day. The EEOC has given us some pandemic guidance. Again, this is from 2009. We will be going over that. It was written for H1N1. We've adopted it and brought it up to compliance here with COVID-19. We'll go over some of the more interesting questions raised in that guidance, and some of it may surprise you, but not really if you're up to date on all the ADA rules and what have you. There are wage and hour considerations here. Again, I will reiterate it throughout today. The determination of whether to make someone go home. Are you sick? Go home. Don't come in. You're sick. You can mandate those things. Nice and simple. That determination has nothing to do with, do I have to pay them? All right. That is a separate determination, which we have to run independence. it could be contingent on what is, if they're a union employee, it could be contingent on do they have an employment contract. It may be contingent on what you put in their Wage Theft Prevention Act notice. Remember, you can have different rates of pay if the employee is doing different things. You never can go below minimum wage, and you can't violate overtime requirements. Am I allowed to change the hourly rate of an employee, a non-exempt employee, during this crisis? Yes, you can reduce it if you wish. Just do a new Wage Theft Prevention Act notice. Some employers are doing that as a means to keep more people gainfully employed. Another thing that I will tell you before you make any decisions on layoff, furloughs, reduction of hours, we should have a chat. The federal stimulus money is there. The federal loan is there. They have, you might be surprised at what you may be eligible for. I will tell you this, there's money there. It's going to disappear quickly. You need to get out in front of this and set up meetings with your bankers and see what you want to apply for, et cetera. Another great source of information is the New York State Department of Health's website, updated constantly with new information. Yesterday, there was new information. We're starting to see this now. Employees who had COVID-19 recovered and are ready to come back to work. So we're now moving into that situation. So we're going to have some issues there that will come up as well. And just be aware that there is now guidance being issued by the Department of Health. Another decent source of information, I'll be honest, is the World Health Organization. I haven't gone here too much. I did initially. I really haven't needed to go farther than the CDC and the New York State Department of Health. We will also discuss as we go out this presentation today, your local departments of health. There will be reasons for you to go to their website, and your local county executive, there will be reasons for you to go to their sites. We're seeing executive orders issued by county executives relative to anyone who has been tested for COVID-19, that they're ordered quarantine. That will count as a quarantine order under state law. We have to go and look, though, to see if such an order it exists. So there are other websites you will have to look into, but just so you know, these are the key ones just to get you started. All right, let's first talk about the employment policy and why it's important that you have an employment policy in place. Some of you may have something broader called the pandemic policy. Some of you have something very similar called an infectious disease policy. Okay, all are good. Maybe you need an addendum for COVID-19, which is probably going to be my recommendation. What should be in the employment policy? I'm going to go over from the 25,000-foot perspective. Background on COVID-19, what are the symptoms? What procedures are you going to put in place to prevent the spread of the infection? What if you have to care for others? Maybe your minor child has COVID-19. Well, there will be an application package for PFL and disability benefits, which you can apply for. What about my grandmother coming down with COVID-19 and I have to apply? Those will not be the enhanced benefits. They will be regular paid family leave act benefits, and you apply just like you would for paid family leave. There's also FEMLA considerations in that regard. Your policy should also address telecommuting and remote working to the extent you're allowing it. I think most of you are. That's probably the only way you're functioning. As you can tell, lawyers are not essential, but accountants are, and they're making us work from home as well. Travel restrictions. This is the biggest part, and what we're seeing is if you don't want to do a COVID-19 policy per se, at least put in place some travel restrictions, both business and personal. The travel restrictions will have two parts, which I'll review with you: general requirements and travel to high-risk countries. You may ask yourself, who in their right mind would travel to a high-risk country? People do. We have stupid employees. You all know you have stupid employees, and some of them cannot help themselves. And they said, we got a bargain. We're going to go here right now. Why, I don't know, but we will. So under the travel restrictions, a couple things. Notice to the employer. So the policy that I've written, and some of you have and some of you have modified accordingly, says if you're going to New York City or you're going to travel more than 90 miles from your home, you have to tell us where you're going. Why? So you can assess whether or not you're going to impose a quarantine on that employee. Any employee that travels to New York City, I'm sorry, when they come back, 14 days at a minimum. So you can't ban personal travel, but you can limit personal travel in that regard. You want to reserve for yourself the right to direct an employee to self-quarantine in certain cases. That is changing daily. You want to reserve for yourself some rights for medical screening or getting copies of medical tests in that regard. You want to remind employees of leave considerations. If they're eligible, remind them to apply. If they don't remember, send them the applications, tweak them in that regard. What your policy should also address, what are you going to do if you have a confirmed COVID-19 case? What's the quarantine measure you're going to impose? And that's going to trigger a broader issue for you as an employer. Do I shut down? There's a big manufacturer here in Syracuse who closed one of their facilities after one of their employees tested positive. If that occurs, what are we going to do? I don't think it's an easy question, but I think it's one you have to be prepared to answer. Negative tests, an employee was quarantined under your policy, how can they come back to work now in that regard? Non-traveling employee quarantines, maybe the employee was not traveling, but had somehow come in contact with someone who has been diagnosed or suspected of COVID-19. The second part of the travel considerations is banning travel for work to a level 2 or 3 country. At least level 4, we're going to have to consider now the new guidance coming out of the state in that regard. Remember, it's going to be an indirect ban on personal travel. We want you to tell us where you're going so we can assess whether or not we're going to impose a quarantine or something else. You want to identify the level 2 or 3 countries in your policy, and you want to give them the links that I gave you to how to determine what is a level 2 or 3 country. Remember, this list is ever changing, and you want to give your employees the best source of information that you can. Are you going to allow employees to use time off? In some circumstances, you're going to have to under some of the new laws. Some employers, let me tell you what's going on. They're changing their PTO policy because of this. They are suspending their PTO policy because of this. You're free to give away as much money as you want. You're free to allow employees to use their leave banks. But there are employers out there who never anticipated that they would have to pay all of their employees PTO in a given week when no money's coming in the front door. So those things are on the table. You just have to do it right and communicate it to the employees. Again, talk about the 14-day self-quarantine if you come back from a level 2 or 3 country. And in certain cases, I'm going to tell you, get some type of return to work authorization. We'll go over some EEOC guidance either later in this session or in the next session in that regard. Your policy needs to warn your employees this is going to change. It's going to change on a daily basis, and sometimes it's changing multiple times a day. Make them realize you can change it anytime you want without any notice. Okay. So let's talk a little bit about OSHA. How could OSHA come into play here? Well, first, your general duty clause in that regard. OSHA also has some guidance on COVID-19. Remember, most of you, your employee is allowed to file a complaint against you with OSHA, either direct saying they are not in health and safety compliance. Here's why for COVID-19, or they could file a whistleblower complaint. I was terminated, I was demoted because I raised we were unsafe. Here's why. So this can come at you a few different ways in that regard. OSHA encourages you as an employer to develop actions to reduce exposure to COVID-19. In a few slides, I will give you a link to the publication. When you go into the publication, you will see page after page after page on how to do each of these things. So, I could have spent all morning just on OSHA, but, we only have a limited amount of time. So bullet points, and then you can go and take a look. Develop an infectious disease preparedness and response plan. Some of you may have done that after the last pandemic we had back in 2009. Prepare and implement basic infection prevention measures. Hand sanitizer. Do we need to do anything else in the workplace that is very basic in that regard? Develop policies and procedures for prompt identification and isolation of sick people, if appropriate. I think that is the COVID policy that I mentioned to you in that regard. Develop, implement, and communicate about workplace flexibilities and protections that you've put in place. Implement workplace controls, both engineering controls and administrative controls, and discuss safe work practices. Again, some of them, as you go through the list, will be very detailed. Some of them will be very easy for you as an employer to comply with. Some of them very expensive, and you couldn't do it right now given what's going on in New York. Remember, you have to follow your existing OSHA standards. So personal protective equipment, big issue in healthcare providers right now. General duty clause of maintaining a safe workplace for your employees, and bloodborne pathogen standard in that regard. So all those things are, remember, they're there. The guidance is about 60 pages long that OSHA has published. I've given you the link here. Take a look at it. It's well worth at least skimming, but it will help you review the workplace in that regard and what you can do to make it better. One of the things we are seeing a lot of is an employee refusing to work. Now, let's assume for a second you're allowed to be open, and we're talking about an essential business here in New York at this point. OSHA has set forth a very high standard for an employee to meet in order to be able to basically be insubordinate and say, I'm not going to do that. In 30 years of practicing law, I have never seen an employee successful in meeting this standard. I think it's very difficult for an employee to meet. The reason it usually is, it's based on some conjecture on the part of the employee that I just don't want to be anywhere near work because. So let's say you're an essential employer. This employee is necessary to do the essential work. The employee refuses to come in. You can fire them. You can discipline them. Whether you want to is another story, and is totally up to you. But the employee, in order to have OSHA protections from termination and discipline, has to meet all of the following conditions. OSHA has indicated that a worker may refuse dangerous work if all the following factors are met. 1, the employee has asked the employer to eliminate the danger, and the employer failed to do so. So what's an example of that? I'm in healthcare. You want me to go see a patient and you're not giving me personal protective equipment? Are you out of your mind? I want personal protective equipment before I go see the patient. The employer points, it's right over there. You just didn't put it on. The employer will be able to meet that defense easily. The employee refused to work in good faith. That means the employee must genuinely believe there's an imminent danger. It has to be based on reality. It can't be based on pure supposition. Next, as to the employee's assessment, we have the objective part of it. A reasonable person would agree there is real danger of death or serious injury. Ultimately, that's going to be OSHA's call, whether that factor is met. And number 4, it's not practical to get OSHA in here. There's not enough time. You're demanding that I do this now. Very difficult to get. Have not seen it successful ever in 30 years. Okay, now the first piece of legislation that got rolled out here, and I think we all know it was rolled out quickly, is New York State's COVID-19 Sick Leave Act. Sometimes I've seen it referred to as Emergency Sick Leave Act. We have seen multiple sets of guidances issued by the Department of Labor on this. The first one was pulled, then there was none, and then they put a new one up. We've seen multiple notices that for employers, employees. First there was one, then there wasn't one, and now there's a new one. So my point is there will be links to various websites throughout this part of the presentation. Don't be shocked if you go to my link and there's nothing there, or if it's different than what I described, because that's how fluid this is, and it is changing very quickly in that regard. Okay, so this part of the presentation is expanding as the guidance from New York State continues to expand. So we'll talk about some general background about the Leave Act. We're going to talk a little bit about who's a covered employee and who's a covered employer. We're going to talk about the trigger. It's an order of quarantine or isolation, mandatory or precautionary. They're not self-evident. Let me warn you, they are not self-evident. Sometimes you have to go do a little work in that regard. We're going to talk about the benefits that an employee is eligible for under the law. Not necessarily 100% clear. We also have some of you who will be covered by the federal law. You as an employer have to grant the benefit that is the greatest between the two laws in that regard. There are job restoration rules also within that. I'm going to talk a little bit about the complaint procedure that New York State has set up to allow employees to complain. You're going to be very surprised what they're going to be able to complain about. We're going to talk a little bit, some of you may have heard about this Matilda's Law. Governor Cuomo announced it at a press conference. Well, there's only one problem. It is not a law, it is not in writing, and it is not, as the last time I looked, the day before yesterday, it is not embodied in an executive order. But yet when you see the complaint procedure we're going to go through, an employee is allowed to be able to complain about it. And we're not quite sure what to make of this. We think it either A, they've forgotten about it and they forgot to put it in an executive order, it's coming, or they were intentional in what they did, because all of a sudden employers started calling us, can I make a 70-year-old come to work? And according to Matilda's Law, as described by the governor, which again is not in writing anywhere, and on the governor's websites is referred to as a guidance. The answer is no, but the reality is we think the answer is yes. I think you need to use a little common sense in that regard. We'll talk about also eligibility rules under the statute, the benefit application process. Paid family leave is basically going to be the application of choice here. New forms under paid family leave that currently do not exist, and we just want you to be aware of that. And then we'll talk about some compliance information, some links to some websites, some links to the employee and employer notice. There is not a requirement for an employment poster. Do I recommend when we get to the notices that you post them? Yes, I do. Or at least email them out to your employees if your employees are not actually in the office in that regard. So again, let's start with some general background of the statute. Okay, so first, it was passed back on March 18th, signed on March 18th. It's basically enhanced protections for individuals who are under an order of quarantine because of COVID-19. They're entitled to enhanced PFL benefits in some situations, and in some situations they are entitled to enhanced sick leave from their employer, and that has nothing to do with PFL. If you have less than 100 employees, your PFL carrier will have an involvement. If you have more than 100 employees, they will not, except to the extent there is an application for PFL at the end of the COVID-19 sick leave, and then it would be processed as a normal PFL request. Some of you have multiple entities, meaning a parent, subsidiaries, affiliate. Make sure you understand, is your insurance carrier going to count your employees together or separate? Because it will make a difference under who pays under the COVID-19. I got the first dispute going on with an insurance carrier. What is a, quote, employer for purposes of how they defined it within their policy. So that could be an issue for you as well. Initially, the law that the governor announced was that there was going to be a general non-COVID-19 paid sick leave law that they were going to add on as well. That was going to be basically mirrored after New York City's sick leave law. Smartly, they put it back into the budget and did not make it, they did not vote on it. I think that was just a smart move on their part. I do suspect it will pass as part of the budget. We will have another webinar, or maybe even by that time in person, we'll get lucky and have another presentation that we actually see people in the future. But I think that is coming as well, just so you are aware. Okay, so covered employees and covered employers. Now, this is going to get a little fuzzy in part because, initially, the law does not define who is an employee. They simply do not. Based on that, the clear reading appears to imply if you're an employee, you're covered. Full-time, part-time, per diem, etc. If you are an independent contractor, you are not covered. Can't point to anything that says that, but it just uses the term employee in that regard. Remember, there is nothing to stop an independent contractor from applying for PFL, short-term disability, or workers' compensation through your company. You simply oppose it on the ground that the person was not an employee, but rather an independent contractor. Okay, so we're going to talk about the trigger. I've already mentioned it a couple times, but the statutory leave and benefits provision are available to employees who have been officially and formally quarantined or isolated by the state or local government agency. Those orders, I will go through some examples. We now have started to see those, and I'm going to read to you some of the language. I'll give you a link to the Onondaga County COVID-19 executive order. And basically what we're telling everyone is check the county the business is in, both the health and executive, check the county where the employee lives, both the executive branch and the Department of Health. Which one controls, I don't know if they don't come out and say. So we just decided to check both. Now, the law is very good at defining who is not covered. And then some of you are going to quickly pick up, well, this person might be covered under federal law. I understand. So we're going over solely right now the state law just to give you an understanding. We'll go over the federal law when we come back for round 2 of this to better explain it to you. And remember, you have to grant the right that is greatest between the two laws. So don't get confused what I'm going over. It is solely the COVID-19 sick leave provision at this point. Benefits are not going to be available to employees who are in voluntary quarantine or isolation. They call you up one day and say, I've self-quarantined myself, not under the direction of a doctor. They've just quarantined themselves. Benefits are not available under the New York statute in that regard. Employees who fear they may have been infected, not based on reality. It's just based on they're fearful that they have been infected. They are not covered under the New York statute. Those who object to reporting to work for fear of exposure, they are not covered under the law and are not entitled to enhanced benefits. And finally, employees who are placed on leave, could be FEMLA, could be PFL, or some other type of leave, layoff or furlough by an employer. Remember, before you start doing layoffs and furloughs, I want you to consider the federal money that is available, what your options are, and you may want to keep everyone on payroll. Why? Because maybe the feds are going to pay you to do it. That's why. So make sure you understand what your options are in that regard for these SBA loans, et cetera. Please remember the money's going to dry up fast. Everyone's going to try to get a hold of it, so you need to get out in front of it. Our understanding is SBA will start funding these loans next week. It'll be opened up for application, and they're going to move quickly, so get out in front of it. A covered employee does not apply to the following individual. They have been quarantined or isolated. They are asymptomatic, meaning they have no symptoms. They are not yet diagnosed with COVID-19, and they're physically able to work remotely. So maybe there was an order of quarantine put in place, not because there's a positive test, but maybe because you traveled someplace. You feel fine, you're symptom-free, you're covered by the order, you're able to work at home. They are not entitled to the benefits. You're going to have to check with your employee day by day. This could change. They could suddenly become symptomatic. They can suddenly have a diagnosis. They can suddenly not be able to work, in which case the statute is going to be triggered, and you're going to have to handle that, either pay out enhanced sick leave benefits and or start a PFL request and get the paperwork in front of them. The law does not contemplate any benefits for employees who are home caring for children due to mandatory school closures as a result of the pandemic. As you'll see on some slides going forward, the devil's in the details. Some of you are jumping up and down saying, aha, but the federal law is going to kick in. I understand in that regard. We're pointing out the differences, what this law is about, and then there'll be some differences. Put some brevity in this. We all have stupid employees. They felt it necessary to put in the COVID-19 sick leave law a provision that basically says, dear dummy, if you're silly enough to do personal travel to a level 2 or 3 country and you're diagnosed with COVID-19 upon your return, you're not getting the benefit. They thought it was necessary to do that. Very specific requirements have to be met in that regard in order for an employer to defend not giving the COVID sick leave benefit. Okay, so if the employee wanted to voluntarily travel to a level 2 or 3 country as designated by the CDC, the legislation excludes an employee who went there despite the CDC notice. In order for the exclusion to apply, all 4 of these factors have to be met. The travel was not taken as part of the employee's employment, and the direction was not taken at the employer's direction, basically saying the same thing from a different point of view. The employee had notice of the CDC warnings. That is where your written policy comes into play. that is where those links to the CDC website become important that you put in your policy. You gave the employees the tools to figure out what was a level 2 or 3 country. He or she disregarded it. And lastly, the employee is not entitled to benefits for some other reason, which we'll get to later on. If all those conditions are met, the employee is not entitled to the enhanced COVID sick leave in that regard. However, if all those conditions exist, do I have to let them use their sick leave bank at all? The answer is yes. You have to let them use existing accrued but unused paid time off balances for that purpose, but that is all in that regard. And if they have none, they have none. Can I, as an employer, allow my employees to go negative on their sick leave, personal vacation time, etc.? Sure. That's up to you. Again, it falls into the category of you're free to give away as much money as you want. It's your money, but be prudent in that regard, because we don't know how long this is going to last. We don't know what the ultimate outcome is going to be. So allowing them to go negative is costing you money. You're free to. Don't misinterpret what I'm saying. Okay, who is a covered employer? Pretty much everyone. It depends on the size of the business, i.e. employee count as of January 1, 2020, and it depends on income or net income relative to certain employers. So the covered law is going to apply to public and private, for-profit and not-for-profit. It will be contingent, obviously, on size and income in that regard. So let's talk a little bit. I mentioned twice already, and I'm going to mention it in detail now. What is the benefit trigger? And this is where it's not going to be self-obvious to you in that regard. So the exact wording here is the law is going to be triggered where your employee is under a mandatory or precautionary order of quarantine or isolation issued by the state of New York State Department of Health, your local Board of Health, or any government entity duly authorized to issue such orders due to COVID-19. That last one includes your county executive. You have to look, we're going to show you in a second, the Onondaga County executive order. It may have expired now. I don't know if they've renewed it. It did expire, I think, on March 26th. I haven't gone back to see if they've, in fact, renewed it. So you got to go to the local governments, the local Department of Health, your local county executive to see if there are any generic orders that cover individuals in certain cases, and you're going to see that right now. So I've given you the link here to the Onondaga County executive order. It is a self-quarantine order after being tested for COVID-19. In sum and substance, an individual who is tested for COVID-19 must self-quarantine until he or she receives a negative test result. That was based on the March 21 emergency proclamation of the county executive. I basically say it's an executive order issued at the county level. This is the type of announcement you're looking for. I've only found the Onondaga County one thus far, but it is possible that there are others out there. Just because it's not there today, it might be there tomorrow. You're going to have to analyze the others as it comes up in that regard. We're also seeing individual orders. So someone has been diagnosed with COVID-19. The local Department of Health will issue an individual order to Johnny Jones saying, in sum and substance, the following. So we got a hold of one. One of my employers had one of these. The title of the document was Washington County Health Order Directing Isolation and Confinement of a patient suspected of having a serious communicable disease. The order said in sum and substance the following: pursuant to New York State's public health law and New York State sanitary code, you, it's a direction to an individual employee, and will have the employee's name on it, are hereby directed to isolate and confine yourselves for evaluation and or treatment of exposure to COVID-19, a reportable communicable disease that has the potential to adversely affect the health of a public. So it's a direct order applying to you, and it gives the reason why. The order continued. Confinement is to continue until further notice of the undersigned or until service upon you of a court order ordering otherwise. So that is what it said. The employee sent it in. We believe this triggered the COVID-19 sick leave law. So your employee may have one. Will all employees have one? No, they're not going to. New York State just issued guidance to employees on how to get the order of precautionary or mandatory order of quarantine or isolation due to COVID-19. It is an actual document. The link will be here in a minute if you want to go take a look at it. I did see some chatter right before I got on within my office that they might have modified this document this morning. I haven't looked at it to see if the document has been modified, but that was some chatter that I saw. Okay, so the employee basically needs to contact their local health department. On the form that the state has prepared, there's a link to all the local health departments. The local health department should provide a written order in a timely manner, but as you're going to see, they have 30 days to do it. If the employee's local health department is unable to immediately provide the employee with an order, what should the employee do? You want to submit documentation from a licensed medical provider that has treated the employee, attesting that the employee qualifies for an order, and you want to follow up with the local health department to obtain the order and submit it to your insurance carrier or self-insured employer if you're covered by the PFL part of this as soon as it's going to be available. I find it remarkable that they have 30 days to give you the order. In some cases, the COVID sick leave will be over by then. I think the 30 days is really tied into the first 30 days to get the application, the PFL application, into the PFL or the self-insured employer in that regard. Okay, so mandatory isolation. What are the documentation requirements? And you're going to see, depending on which one it is, the documentation requirements are going to be slightly different. You're about to see where New York State has snuck in travel to a level 4 country. I don't know the significance of that yet. It's the first time we have seen it, but we're going to have to figure out what that significance is. So if an employee is subject to a mandatory isolation, what documentation from the employee's licensed medical provider must include? Must include the following. The employee has tested positive for COVID-19 or testing is currently unavailable to the employee. There might be a shortage of tests in some places, but the employee is symptomatic and had contact with someone with a known COVID-19 case. How about the documentation requirements for a mandatory quarantine? What must those be? The employee has been in close contact with someone who is tested positive for COVID-19 or is currently in mandatory isolation, or the employee is symptomatic and has returned within the past 14 days from a country designated by the CDC as a level 2, 3, or 4 advisory for COVID-19. So this is the first time we've seen the level 4 designation come in. Again, we're not quite sure what the significance of it is, but I wanted to point out to you that this may broaden into level 4 countries as well, at least from what we're seeing at the New York level. What is a precautionary quarantine? What documentation must be provided? Okay. The employee is not symptomatic, they're asymptomatic, and they have just returned within the past 14 days from a level 2, 3, or 4 COVID-19 advisory designation country. The employee has been determined to have had proximate exposure with someone who was tested positive for COVID-19. Those are the requirements. Other qualifying events, other things we haven't seen yet. So I showed you an example of a specific order. I showed you a county executive order. I've showed you the general definition. Are there other things out there that may qualify? We think so. Be diligent. There may be other qualifying events we haven't seen. Don't disregard whatever your employee gives you. Be considerate, be compassionate, and then we need to legally evaluate whether what you have been given in fact qualifies. A question that is coming up consistently: does Governor Cuomo's executive orders ordering the 50%, 75%, and 100% of workforce reductions, do they qualify? They do not. I'm using the words probably, and the probably is best because I believe in one of the press conferences, the governor indicated in sum and substance that that was the case. So that is the basis for our belief. Would it surprise me if we see another executive order and we have to reinterpret and we have to analyze? No, it simply would not surprise me. Okay, what is the sick leave benefit that is in fact available? First, I already mentioned this. Some of these will be tied into the employee count. When do we count as of January 1, 2020. That is going to be the date that you count your number of employees. So if it's changed since, it doesn't matter. It's as of 1/1/2020. There are 5 distinct benefit examples that rolls out of the COVID-19 sick leave statutes that I've broken down for you here. So benefit example number 1, I work for a business with 10 or fewer employees, and said business had a net income. You got to look at the net income line on tax returns. If it's not filed, you'll have to figure out what the net income was, and my guess is your accountants can, of less than $1 million in 2019. What is the employee entitled to? Job protected leave. These are all going to be job protected, and PFL and disability benefits through the existing policy that the carrier has in place, up to a maximum of $2,884.62 per week for the duration of the mandatory or precautionary order of quarantine. What if the employee at the end of the mandatory or precautionary order of quarantine is still sick, but they're no longer quarantined? That employee can apply for short-term disability benefits, and it would default, if they're eligible, it would default to the short-term disability benefit, which I think is 170. Benefit example number 2, very similar, 10 or fewer, but had a net income of $1 million or more in 2019. The first part of the leave are 5 days of paid sick leave by the employer for the duration of the quarantine order, and then you'll see what happens next. These 5 sick days are on top of, not in lieu of, whatever the employee currently has. So it's a build up in that regard. You cannot hit their leave bank. They are entitled to this above their leave bank. After these 5 paid sick days by the employer, they are able to apply for PFL and DB, the enhanced benefits, up to $2,800 per week for the duration of the mandatory or precautionary quarantine. Benefit example number 3, we have between 11 and 99 employees. There's no indication of any amount of income here. It is the same rule as benefit example number 1. Benefit example number 2. 5 days of paid sick leave. The employee can then apply under the PFL DB policy for the enhanced benefit up to $2,884 in that regard. This is where it gets interesting. If you have 100 or more employees, the employee is entitled to job protection for the duration of the quarantine, as all of these are, and 14 days of paid sick leave. It's on the employer. Those 14 days of paid sick leave. Are there enhanced paid family leave and disability benefits? No, there are not. If at the end of the 14 days, the employee is still sick, they can apply for disability, short-term disability benefits, and they'll get them in that regard. Okay, next, benefit example 5, and it's our last example. If an employee works for a public employer, it doesn't matter how many employees the public employer has, job protected and 14 days of paid sick leave. This one makes a lot of sense to me. Public employers have to opt in to PFL. So unless the public employer opted in to PFL, they don't have a PFL policy, and they in that regard. So that makes some sense to me. What is a public employer? Town, public school, public college, university, county, city, village, fire district in the state of New York are examples that the state uses to define a public employer. Pretty obvious. What if I'm still sick after 14 days? So I'm in the 100. Again, I already mentioned you can apply for short-term disability benefits, but it does not appear, based on the clear language of the law, that the employee is entitled to enhanced PFL and disability benefits. It does make sense to me. The reason is, remember, PFL and disability are employee funded. You may be a nice employer and you might pay it for them, but that is not the majority. So the money to fund PFL and disability comes out of employee paychecks. Suddenly, the money being paid out is going to be much greater. And I think we're going to see a problem in that regard. How much do I have to pay an employee if the sick leave component kicks in? What is the rate of pay that the employer has to give the employee? So the employer must pay the amount that the worker would have otherwise received had they been continuing to work for the period of time based upon the amount that the employee was scheduled or would have been scheduled had the employer's operations continued in normal due course. So how many days would they have actually have worked in that 5 or 14-day period? That is what we're going to wind up paying them. An employee worked a fixed schedule or paid a salary should simply continue to receive pay for the applicable period of time. An hourly, part-time, commission or commission salesman or other employees who are not paid a fixed wage, you're allowed to do some averaging here. Employers should determine the employee's pay by looking at a representative period of time to set the employee's average daily pay rate. Whatever you're going to do in that regard, I would tell you to be consistent and do the same test for everyone across the board. They really haven't given us any guidance beyond that, so I think you're free to do what you want. What some employers are doing is they're basically using the PFL1. There's an average weekly wage calculation, and they're using that to determine the average daily pay rate. That's fine. I don't care how you back into it as long as you do. What about part-time payments? If my employee is only scheduled to work on a part-time basis over 14 days, let's say over a 14-day period, they would only have worked 2 days. Am I obligated to pay them 14 days or 2 days? 2 days. Part-time employees should be paid the number of days and the amount of time during the applicable period. Remember, there's a 5-day and a 14-day rule that they are required to receive pay would they have otherwise been working on the normal schedule. So you look at in a 14-day period, and remember, what is the 14-day period? Is it working days or calendar days? It's calendar days. It is not a workday test. It is a calendar day test. And some of you that may have listened to my presentation on COVID-19 a couple weeks ago, This guidance was not out, and that's why you got to stay up to date and on top of this. The sick day payments, when do you have to pay them? Basically, whatever frequency you are required under the labor law to pay your employees, that is the same frequency with which you have to pay the sick leaves. Is there a waiting period for short-term for these enhanced PFL disability benefits? There is no waiting period. You can claim benefits as soon as you have that trigger, that order that has been put in place, and you can go ahead and make your application or request the sick time from your employer and then make the application. Is there any obligation that the employee has to repay the employer the COVID-19 sick leave benefits? There is not. There is no obligation whatsoever. Don't do it. Accrual use. Can the employer require that they use their existing sick leave bank? No, you cannot. You can, whatever the 5 or 14 days or the pro rata amount based on if they're part-time that you have to give, it's in addition to whatever you've already given the employee in that regard. It's not in lieu of and what have you. Are the benefits retroactive? Yes, potentially. An employee may take quarantine leave if they are still currently under an order of mandatory precautionary order issued by the appropriate entity, even if that order was issued prior to the effective date of the law, March 18, 2020. So there were some people that were quarantined before this law went into place, very limited group that would be able to apply for retroactive benefits. I've already highlighted the fact that PFL and disability benefits are paid by the employee. This is going to destabilize the risk adjustment pool that the Department of Financial Services modifies every year based on how much the PFL and short-term disability deduction should be. Under the legislation, the Department of Financial Services was directed, go back, recalculate if necessary. There may be a recalculation coming from the Department of Financial Services that will increase the amount of the PFL and or short-term disability deduction coming out of an employee's paycheck. One of the things I've also heard, and again, until it's law, I don't really care about the rumors, is that the employer, there's some scuttlebutt, the employer may be asked to pick up the difference, just so you're aware that that is a possibility. Again, though, wait for the existing law to come out in that regard. Okay, I mentioned consistently under all 5 benefit examples, the employee has the right to job restoration. We're familiar with this concept under family and medical leave. We're familiar with this concept under paid family leave in that regard, and it continues here in the COVID statute. Is the employee's job protected during the COVID-19 leave? Yes, it is. The employee is entitled to be restored to the position held prior to taking the leave, not an equivalent position, the position held prior to taking the leave. So let's say the sick leave ends, you go into PFL, the enhanced PFL ends, and then you're in regular short-term disability. Does this rule apply? I don't think it does. I think this is only why you're in the COVID situation. Once you're outside of that, this rule no longer applies. An employee cannot be fired because they took COVID leave. An employer cannot fire an employee or take any action against them because they took the leave. Say the same thing, said 2 different ways. Don't go after the employee because they applied for this leave or in fact took it. COVID-19 sick leave should not be counted as an absence that may lead to the result in discipline, discharge, demotion, suspension, or other adverse employment action. Don't count it against the employee in any manner is the rule coming out of the law and the guidance issued by the New York State Department of Labor. Populated, I think last Friday or this Monday, The Department of Labor has now set up an online employee complaint mechanism for employees to complain. We now have indication that clients are being called by the New York State Attorney General and being asked a question: why are you open? What makes you think you're an essential business? We're learning. We've asked the Department of Law, why are you making this call? And they're being very blunt. An employee complaint. We want to know why you're open, and you should tell them, and you better be right. If anyone on this call is not an essential business and you're open, you're playing with fire. I can assure you of that. If anyone is essential business and you're doing non-essential work, you're playing with fire. I can also assure you of that. So employee complaints in general, an employee under the COVID sick leave statute may complain about the employer using the online mechanism, which I'll give you the link to in a minute, under the following conditions, and it will be investigated by the department. The employee qualifies for COVID paid sick leave, and you're refusing to pay it. You're saying, hell no, I'm not going to give it to you. That is your right, but you better be correct in that regard. And if you're wrong, the Department of Law and Department of Labor are coming down on you. The employee is being forced to work at a non-essential business. Non-essential businesses should not be open, and they're allowed to complain about it. The employee is being forced to work for an essential business, even though the employee does not perform an essential function. Again, you're playing with fire if you go down that path and what have you. The employee is being forced to work for an essential business at a work site when they could be working at home. Remember, if you're an essential business and you're allowed to be open, the state of New York still wants you sending as many people home to do work as possible. Number 5, the employee works for an essential business that is not following health and safety mandates. Remember, the employee can also file a complaint with OSHA, with the Department of Health, in that regard, and also with the New York State Department of Law. So there's lots of ways they're going to come down on you if you're doing these things. Number 6, this is that Matilda's law that is not in writing and is not in any executive order that was announced by the governor at a press conference. You look on the governor's website, it is referred to as, quote, guidance. That's it. It's guidance. It's not a law. It is not an executive order. I find it remarkable that they're going to allow employees to complain about something that is not a law or an executive order. The employee is being forced to work for a business, and the employee is particularly frightened because the employee is over 70 and has an underlying illness. Now, one of the things I want you to keep in mind here, nothing in the COVID sick leave statute prevents you from making and handling a reasonable accommodation request. So if an employee gives you a medical note, I have an underlying condition, I should not be at work, or I should be allowed to work at home, given my medical condition. Run it as a reasonable accommodation request. That's all it is. It's a reasonable accommodation request. You have to consider it. You have the right to claim undue hardship under the analysis, but make sure you're correct. The 7th complaint that an employee can make, the employer has failed to pay the sick pay or paid time off, whatever you may call it. The employer has failed to pay the employee's earned wages or pay for all of the hours they work. That's just the general wage and hour complaint. I think they're just reinforcing, hey, if you're working for an essential business and they're trying not to pay you, that's BS. You can file a complaint. The employer has threatened or fired an employee for reasons related to COVID-19. The employer is forcing an employee to work when they are sick. You should be doing quite the opposite. You have the absolute authority to send anyone home that is at work and gets sick, and you have the absolute authority to tell someone who is home, stay at home until you're no longer sick. All right. And most employers don't realize that. You probably do now. What you have to pay them is a separate determination in that regard. Number 11, the last category, the employee knows about a business that is non-essential and is operating. So if you want to blow in your competition, you're allowed to file a complaint with the New York State Department of Labor. So if you know your competitor is ignoring the essential business designations and is open for business, you are free to file a complaint against that entity, and beware, they're free to file a complaint against you if you're open for business as well in that regard. I've given you the link to the online complaint form. I can't go too deep into the complaint form because it actually requires me to fill out information, including my name, my email address, and stuff before it takes me to the second screen. So I haven't seen the full complement of what it is that they're asking for there. The New York State Department of Labor also has set up a specific web link for how to file a complaint. I've given you that link here in case you want to take a look at it. Okay, so let's talk about some eligibility rules. Some of these I've mentioned, I'm just reiterating them. I voluntarily quarantined myself. That's it. I might have COVID-19. It's not based on reality. I just think I do. Am I covered by the COVID-19 quarantine law? I am not, very clearly. I get into who may issue the order. I've already explained that in depth for you. The school closing one, I think the devil is in the details. The employee's child's school is closed due to coronavirus, COVID-19. Can the employee take PFL disability quarantine leave to stay at home with them? I think it depends. The devil is in the details on exactly the underlying order that is going to kick in and justify that. And we've got to make sure it qualifies. I'm not sure it's going to matter much if you're covered by the federal law. Okay. What if my employer goes out of business or closes in full during COVID-19? You may be eligible for unemployment. And they've set up a COVID-19 unemployment link here, and it explains to you, we'll go through the benefits a little bit, but, we're going to have I think we have a problem brewing. You take the maximum New York benefit of what, $505, and you couple that with the $600 the feds are going to give you on top of that. An employee is going to be making more on unemployment. Some employees will be making more on unemployment than they would if they are working. How are we going to get them off unemployment in that regard? I know we're just starting to work on those issues now. The benefit application itself, for the sick part, the sick leave, the 5 or 14 days, there's no application. But I'm going to have to comply with my employer's normal requirements, and I'm going to, I'm out sick, who do you call? And I'm going to have to give them some proof that I'm in quarantine or isolated and the reason why. It's not enough for the employee to call up and say, my doctor has told me I have COVID-19 and I'm isolated. Send me those 14 days of sick leave, and I'll be back when this is all over with. No, not enough. You're allowed to get some medical documentation to prove that is the case. The timing of the statutory benefit, the state is saying make sure you apply within 30 days of first needing to take the leave. You start going longer than that, it's going to be limited to 30-day look back. The New York State Workers' Compensation Board has set up a link specifically for COVID-19 and paid family leave. I've given you that link here. It has the forms I'm about to go over. It has Q&A. It has other explanations, benefit calculations, etc., that will help you walk you through the process. Most of you will have a carrier in that regard, but you might get into some disputes with your carrier here based on your employee count. Make sure you're prepared to justify why you are correct with your carrier and push back if the carrier is wrong. To apply for the enhanced PFL disability comp during the quarantine, the employee must notify their employer and submit the applicable paperwork. Got to get them the forms. You may have to mail them to them, you may have to email them to them. They may be able to go to your website to pull them down, okay? Remember, part of this is going to be also the employee completes their PFL packet. They give it to you. You have 3 days to complete your packet. You got to think through now, folks, how are they going to get their packet to you, especially if you're not in the office. If the application is for the employees themselves, meaning they're entitled to COVID-19 sick leave, there is a form S-COVID-19. S stands for self, in a combined PFL-1. I've given you the link to that document. The PFL-1 is the PFL-1 form that we are all used to. The application process for self, the employee needs to complete all the employee sections, and the employee then submits it to the employer for the employer to complete their sections. That's where you got to make sure your process is in place, especially if everyone is working from home in that regard. Remember the general PFL rule, the employer has 3 days to complete the employer parts of the PFL-1 and the COVID quarantine package. If the employee does not receive it back within 3 business days, the employee is free to send that directly to the carrier in that regard. How are they going to know who the carrier is? Well, it might be should be on your PFL employment poster. Maybe your PFL employment poster is online. Maybe they took a copy of the PFL poster. Maybe it's in your handbook. Maybe you've told them who it is. And the other way, the simple way, they go to the New York State Workers' Compensation Board. I can look up every employer in the state of New York, tell you who their comp carrier is, who their disability carrier is, and who their PFL carrier is, which should be the same as their DB. So anyone can do that, not a big deal. The employee will submit the completed forms along with the order to the disability PFL carrier. Only difference here would be if you're self-insured, it goes to you as opposed to the carrier. What if I am caring for my minor child, dependent child who has COVID-19? It's a PFL-1 form plus this C COVID-19. C stands for child. And I've given you the link to that. Well, Mike, why isn't this a serious health condition? Well, it normally would be, but they've expedited it. They've taken out the serious health condition analysis to expedite the application process here. It is the same process for the minor child that I went through for the adult. If an employee is eligible, is an eligible employee whose dependent child is under one of the requisite orders, the employee may be able to take PFL for the duration of the quarantine or isolation. It is not the enhanced benefit. It is the normal PFL benefit that would apply. So all the normal PFL calculation rules will apply 60% of your average AWW up to the state cap, and it maxes out, and what have you. So the regular rules apply in that case. What if it is a family member? We then have to, non-minor child. It is a serious health condition analysis. We fill out the serious health condition forms, the medical release authorization, and we run it that way, which we are all used to. Again, normal PFL rules would apply in that case. What happens when my insurance carrier or self-insured employer gets it? They have 18 days to pay or deny the claim. If the package was incomplete, I think the carrier has 5 days to send it back to you saying what's the matter, what you didn't complete, and then you have to send it back and the 18 days starts again. If the employer refuses to or just doesn't get it on the PFL forms, the employee is allowed to send it into the insurance carrier, and the carrier cannot deny the application solely because the employer section was not complete. Now, my guess is the carrier will pick up the phone and say, what the heck? What's going on here? Why you guys haven't done this? So make sure you review your PFL policy and modify it accordingly on a temporary basis, how employees can apply for PFL. Okay, so I've already mentioned employer in the forms and the sections you have to complete. I've given you a little more info here, not really worth going into, but it's obvious. I mentioned also throughout this presentation that to the extent you're covered by both the state law and federal law, you have to grant the largest benefit that applies between the two. That is the rule under the New York COVID statute. And that is the rule that you're going to have to comply with. Lastly, let's talk about a few compliance issues. Is there a mandatory employment poster? I've answered that no. However, there are some notices. It looks like an employment poster. Go ahead and put one of these up. I don't care. You know, attach one of these to your COVID-19 policy. Go ahead. I don't care. I've given you the link here. Remember what I said earlier, the states already revised these one time. There was a period of time these links were dead and there was nothing there. Now, as of Monday, these posters are up and they're there. I don't know if they're going to change them again. They might. So if you're going to, if you're interested in them, I download them, save them, and use them. The funny thing is, you know, when I downloaded the first one, I had put it on my LinkedIn page. I had sent it out to dozens of employers, and the next thing you know, it's gone. One of my HR consultants I deal with, she calls me up and says, "Where are these posters?" And I went and looked. I said they were gone. I got a question. Employees are only eligible for PFL for scheduled days, correct? That is correct. We basically would look at what their schedule is going to be. It doesn't mean that all of a sudden, if they're working on a part-time basis, it doesn't mean they're automatically converted to full-time and they get the maximum benefits. We had someone apply for PFL for the days she is not scheduled. She would be ineligible. That is correct. I mean, ultimately, it will be your insurance carrier's determination if, based on her history, her schedule, that she wants to take Friday, Saturday, and Sunday off as PFL days and work Monday through Thursday, but her normal work schedule is always only Monday through Thursday. She's not allowed to have Friday, Saturday, and Sunday off. We have seen employees. Sometimes it's intentional, sometimes it's not. Try to work the system to try to get PFL and their regular pay. We had one individual, really smart. He worked, I think, 3 days a week. He took PFL intermittently for the 3 days a week, or maybe it was blocked. I don't remember. But they're in such desperate need of workers, he then worked outside of his normal shift and would work on the weekends and get the more benefits, more pay for working on the weekends. Working on the weekends, his normal 20 hours a week, it was getting PFL benefits for his normal 20 hours a week. So we came up with a way to get him off PFL, but it's surprising some of the things that people will think of in that regard. So here's the link to the employer version of the poster. There's not much difference between the two. I don't know why they decided to come up with two of them. Either one works for me. Okay, I mentioned to you there is a difference between saying to an employee, stay home, you're sick, or go home, you're sick, and whether you have to pay them. That determination is tied into a collective bargaining agreement, could be tied into an employment contract, typically is tied into your Wage Theft Prevention Act. Is the employee exempt or non-exempt for purposes of that law? So that's really what's going to drive this here. There's nothing here that shouldn't shock you. We are getting this question. My workforce is so depleted, can I use volunteers? No. If you're a for-profit, there is no such thing as a volunteer in your workplace unless it's the intern. Public sectors and privates can use volunteers very limitedly, but you got to comply with the rules fully. How many hours is an employer obligated to pay an hourly paid employee who works a partial week because the employer's business is closed. Non-exempt employees just got to pay for actual hours worked, barring something else. Keep that in mind. So if I send Johnny home, he's a non-exempt employee, and he's not doing any work at home, I don't owe him any money because he's not working. Now, the benefit package that you want to do, whether you want to continue to pay him, those are separate issues. But you're allowed to let them use their PFL. Some employers, again, are not their PFL, their PTO. Some employers are freezing the PTO, sick, and vacation. Some employers are suspending them, modifying them. Those are all things that are on the table given this current situation we find ourselves in. Remember, in your employee handbook, my guess is there is a policy that says we are allowed to change this for on no notice at any time or whatever it may be. If an employer directs a salary exempt employee to take vacation or leave banks or leave without pay during office closures or other public health emergency, does this impact the exempt status? Generally speaking, allowing an employee to use leave banks does not jeopardize exempt status. Remember, you always have to comply with the salary basis rules under the Fair Labor Standard Act, and just keep that in mind. Remember, if you have a salaried exempt employee at home and they do no work, nothing, they don't answer a text message, an email, or make a phone call, nothing, you don't have to pay a salaried exempt employee if they do no work in a work week. However, if they do 1 second of work, you have to pay them for the week, and then you can analyze, can I make them use leave banks while they're home? Yes, you can. Okay, most of this stuff I just went over, and you can read it, but I summarized it really quick. Okay, we have a question. We are not considered an essential employer, but we have live animals we take care of. So we have a few employees going into the workplace to do the daily, but no one is there at the same time. If one of those employees ends up sick or quarantined during this time, am I allowed to, should I let the other employees know? If this happens, I'm unsure whether HIPAA violation. Okay, so we're seeing this a lot. First, make sure under the executive order and the designation of essential businesses that you're allowed to have anyone in there. And if you're not, please apply to the state of New York saying the reason why, because just you may not be allowed to have that one employee in there. So the question is coming up, Jane Jones has been diagnosed with COVID-19. Who can I tell? Supervisors with a need to know can know the identity of the person. All others, it is an employee. Remember the ADA medical confidentiality requirements? Has nothing to do with HIPAA. It's all based on the ADA and the New York State Human Rights Law. Those require only disclose medical conditions of your employees to supervisors with a need to know. All others, including supervisors who don't have a need to know, and the non-managers have no right to know that information. So please keep that in mind. Another question we're getting is the one I have up here on the screen. Your employees come to work every day and do their jobs. I'm sure you've heard an employee say, that's not in my job description. There's nothing in the Fair Labor Standards Act that prevents you as the employer from changing the job. Now, there might be in a collective bargaining agreement, there might be in an employment contract. That's why the devil's in the details on those. But otherwise, you can move around an employee's job duties, make them do something they don't want to do. That's, as long as it's not illegal, I could care less. Remember, the employment of minors, they can only do what the law allows them to do. So if they're less than 18, you have to make sure they're not doing illegal employment. If you the same is true if you have a formal job description, the same rule applies. Remember the two exceptions, collective bargaining agreement and employment contracts. I've heard great stories about some of the unions and hospitals. They're sort of saying, what do you need our employees to do? We're doing it. Employment contracts, I have seen physicians saying, all right, I'm not going to hold you to the terms of the contract. What do you need me to do? But they might be able to, or keep that in mind and remember. May an employer encourage or require employees to work from home? Absolutely. We have no choice in this environment. One, you can always encourage that, and two, you are required to if they're non-essential. There may not be any work for them to do at home, or they may be unable to do their job at home, in which case they're basically going to be furloughed or laid off. There is a difference. Furloughed, you're still an employee, and you're laid off for a set period of time. Keeps you on employee benefits. A layoff is basically a termination and an ending of employee benefits. The devil's in the details to make sure the Department of Labor does not view a furlough as continued employment, which would not allow the employee to collect benefits. So just be careful what words matter is my point. You can't single out anyone to work at home. So you can't say, for instance, I don't think anyone would do this. Say, all African Americans, you have to work at home. All men, you got to work at home. All women, you got to work at home. Any Roman Catholics have to work at home. You can't do that. Don't pick on any of the protected classes. Do I have to pay the employee the same salary or hourly rate when they work at home? Generally, yes, unless you have something in your Wage Theft Prevention Act form that says otherwise. Remember, you can lower someone's hourly rate to minimum wage. You can convert a salary exempt employee to a non-exempt hourly and bring the rate all the way down to minimum wage to keep them employed. Just don't violate the minimum wage or overtime requirements. There may be special rules if you're covered under the Service Contract Act. Just keep that in mind. So the state of New York has barred non-essential employers and non-essential employees from working. Do I have to pay them when they go home? Again, the non-exempt, it's easy, only actual hours worked. And then the salaried exempt, you don't have to pay for any hours. They do no work, but if they do any work, you do, and you can mandate that they hit the leave banks. Don't forget the overtime rules. Non-exempt, they go over 40 hours, which there may be a risk of here. Because remember, some businesses can't find anyone to work right now. Go to Walmart, go to Wegmans, go to Tops, Target. They are dying to get people to apply. Pizza delivery places, food delivery places probably can't get enough employees at this time. So there is work out there, and there's lots of hiring potential going on. And again, I do feel your pain because there is now going to be, I don't want to work. I want the enhanced unemployment benefit, and I'd rather be in unemployment. That's going to be an issue we're going to have to deal with. You can't charge an employee that works at home or expect them to front a lot of additional costs. So get a new phone line, get internet, go get a computer. You can't mandate those things. The FLSA would be very demanding on an employer that these things would dip an employee below minimum wage, and there might be a minimum wage violation. One of the things that also comes up quite regularly is, does OSHA, if I let my employees at home, they go to start inspecting my employees' home? The answer is no. There are no OSHA regs that cover telework and working at a home office. They might take a complaint. They might notify the complaint to the employer, but they will take no action in that regard. So remember, though, you have to keep track of work-related injuries and illnesses that may occur while someone is working at home. Well, what do you mean? I mean, they trip over their bag at home while working and they break their arm. It's a comp case? Yeah, it is. So beware. The comp cases can come out of working at home. I don't know what type of proof you're going to have because there's no one there to see it. So that's a repercussion of allowing people to work at home. There's going to be another big repercussion here. Individuals will ask for a reasonable accommodation request. The reasonable accommodation request, I want to work at home. For years, my employers have been saying, oh, that's not practical. That's not possible. Guess what? I think we just proved that it is for some employees. So beware, that's going to be an unintended consequence of letting people work at home in the future. Okay, I mentioned this a little bit, union and employment contracts. The words in the collective bargaining agreement matter. Scope of work, what you're going to pay. The words in an employment contract matter. Scope of work, what you're going to pay. We just had a situation come up where they want to change the employee from a salary to hourly. And the employee had an employment contract. So the employer was taking the position, it's not an employment contract. I said, send it to me. I read it. What's it entitled? Employment agreement. It's an employment contract. What did it say about salary? Employee will be a salaried exempt employee paid $95,000 a year, period. It didn't say anything about being able to convert that employee. Didn't say anything about being able to pay them otherwise. But there was a saving clause in the contract that said, subject to the rules as set forth in the employee handbook. One of the rules in the employee handbook was we can change your pay at any time. So we were able to do that. So words matter. Keep that in mind. I'm not saying that you're gonna, but I'm saying some of you may have to consider it depending on how long this goes forward in that regard. Talk a little bit about workers' comp. Now, this scenario, I just want a couple scenarios to keep in mind. You all listening very close to the Pennsylvania border. You probably have some employees in Pennsylvania that come to work every day. If you are allowing that Pennsylvania employee to work at home in Pennsylvania, does your New York State workers' compensation policy cover it? Generally speaking, if it's a temporary thing, yes, it does. The question will be begged, what is temporary? The other thing you have to realize is the Pennsylvania Workers' Comp Board may take a different view of you allowing there. So best practice is going to be for you to add on the coverage in the other state. Can we fire, I have a question, can we fire people and prevent them from coming back because they're too scared to work? We are open, but they don't want to work. We are essentials. Yes. I bet you never thought I'd say that. Yeah, you can. We're getting this a lot. Employees without basis, or maybe it does have a rational basis. I'm scared to death. I don't want to come back because I don't want to be around anyone. I don't want to be exposed to the possibility of COVID-19. Can I discipline that employee? You most certainly can. Devil's in the details, write them up, etc. This other example, I will have to give you off the top of my head. That's a tough one to come up with, but I'll answer that one offline, or I'll announce the answer at the next one. Okay, workers' comp and unemployment. Remember, resident incidental travel. So when you and if you can email me that question, because my email is on the slide, I will get you an answer by the time to the next time. Resident matters of the employee is going to matter. Incidental travel to another state's fine. Temporary work outside of New York's fine. Remember, what is temporary? That's where we're going to get into this. We don't know how long this is going to last. To be covered by New York, there must be a substantial connection to New York. There is. You're here working. It's a fact-specific inquiry in that regard. Normally, the employee commuting from their home to work, from work to their home, is not compensable as workers' compensation. What if you're allowing them to work at home, working at home? They need something for work, they go out and get it. While there, they get in a car accident and they come back. There's no deviation. It was work-related. I think that's a work-related injury. Please check with the Pennsylvania. make sure, check with your insurance agent, make sure you're covered. If they tell you temporary work in another state is covered, I want you to push back. What is temporary? Where is the definition of that? We don't know how long this is going to last. Make your agent answer the question. Don't accept the temporary from them. Make them answer the question. Best practice, add Pennsylvania onto your policy. You're allowed to have employees work at their home and what have you. Unemployment obviously is going to be a big consideration. We'll talk about it a lot in the next one now that we have enhanced unemployment in that regard. Every once in a while, when you allow someone to work at home in another state, they try to make a claim for unemployment benefits under that state's. And there's a test here. I'm not going to go through it because it's very remote possibility that these things would occur. But it's possible. I just want to alert you. Guidance from the New York State Workers' Compensation Board in that regard. One thing I do want to tell you about is business interruption insurance. If you don't have it now, it might be too late. The devil is in the details. What is covered if we had to shut down because of COVID-19? Would a policy pay my employees while they are out and we are closed? Maybe. It depends on the policy. A lot of these policies have virus exclusions. COVID-19 is a virus, okay? So most of these policies would not pay. Some will. I actually have my first one who's going to pay the employees in that regard while their wages while they're out, subject to a big deductible by the employer, but it's happening. Take a look at it. Ask your agent. 1, do you have it? 2, does it cover the situation? 3, if you don't have it, maybe you want to think about getting it for the next time. I don't know if there will be a next time. Let's hope there isn't. Okay, so it's about 11:50. We're going to cover parts of the EEOC guidance, and then after that, I'm going to stop right around 12 or a couple minutes before, and then we'll pick up in the second session. And you're like, damn, you're firing a lot of info at me. Yeah, and it's only going to get worse. And so remember that. So the EEOC has jurisdiction over the Americans with Disabilities Act and the Rehab Act. They issued guidance on March 19th to help employers in that regard. First, don't think for 1 second the ADA or the human rights law get in your way of complying with CDC or your public health standards. They do not. You follow the CDC. You follow what your Department of Health says. To hell with what the ADA says in that regard, and the EEOC has said as much in this new guidance. The EEOC believes you have an obligation to stay up to date with the public health authorities on COVID-19. They have said as much in this guidance. Stay up to date. Go to the CDC, World Health Organization, your state Department of Health or local Department of Health. Facebook does not count. It does not count, okay? Social media does not count. I want you to go to the main source to make sure you're getting the best information. The EEOC reinforced the pandemic guidance that I mentioned that they had published during the H1N1 pandemic back in 2009. They basically said, hey, it's still good. There's not much changes. They changed it, a few things around that we're seeing time and time again here. A couple weeks ago, I said probably was the answer to this question. Now it's a definite yes. May a ADA covered employer take the body temperature of employees during a COVID-19 pandemic? Yes. The measurement of body temperature is going to be deemed a medical exam. However, given this how widespread COVID-19 is, and that having a temperature is a potential symptom, it has been ruled okay by the EEOC. Go ahead and do it, but do it for everyone, or just if you're targeting people, make sure there's some reason they're sick, send them home. EEOC warns not everyone will have a fever if they have COVID-19. So keep that in mind. These next set of questions might surprise some of you. If an employer is hiring, may it screen applicants for symptoms of COVID-19? The answer is yes, you can. If you do a medical exam after you've been given a conditional offer of employment, and you do that conditional offer of employment subject to a medical exam for all employees entering in the same job class, you can screen for COVID-19. Doesn't matter if the employee is disabled or not. May an employer delay the start of an applicant who has COVID-19 or symptoms associated with it? Yes, you can. According to CDC guidance, if your employee has COVID-19, they can't go to work. And if they have symptoms, they should not come to work, and you should not let them come to work. So yes, you can deny. May an employer withdraw a job offer when it needs the applicant to start right away, but the individual is temporarily quarantined because of COVID-19 or symptoms related to it? Yes, you can. You can either delay the job offer or withdraw the job offer. Now, some of you are running across the following circumstance unrelated to COVID-19. We hired Johnny to come to work, but there's no work for him. His start date's a month away. Can I undo the offer? Yes, you can. Call up the phone, be honest, either suspend it or withdraw it. All right, you're allowed to do that. The new guidance is here at the EEOC's website. I've given you the link. So that we're at about the 2-hour mark. I'm going to stop there. We will pick up with the Families First Coronavirus Response Act, which will go at the next seminar. We'll go a good 90 minutes on that. I actually may update the slides or give you a couple handouts in addition to it that we will go through. So if there's any other questions, if you want to type them in now, otherwise we will stop. So I'll give you a second, see if there's any questions. I think we answered all of them, and whoever typed that one question, if you could be so kind as just to email it to me. And I can get you an example, but I can't think about it off the top of my head. Okay. All right, so seeing no questions, we will call an end to today's. Beware, everything I went over today is subject to change. I really hate to say that to you, but we're seeing it more and more. The state is just changing their guidance. So with that, I'll talk to you all soon. We'll come back on the Family First Coronavirus Response Act. And everyone have a great day. Stay safe and stay at home. Take care, everyone.